Welcome to A Focus on Health. I'm Nikki Devitt, president of the Petoskey Regional Chamber of Commerce. And as February is American Heart Month, we are very lucky to have McLaren Northern Michigan in our own backyard. One of the nation's top 50 cardiovascular hospitals is right here in Petoskey. So today we have with us Caitlin Schaller, who is with the cardiovascular program at McLaren Northern Michigan, to talk about heart healthy lifestyle and McLaren's new Get Up and Move initiative. Hi, thank you so much, Caitlin. I appreciate it.
Yeah, thanks for having me.
So we've been in COVID now for almost a year, and we keep hearing about this trend to not get your health checkups or keep your appointments. Are you seeing this? Is it really out there? We hear about it, but is it happening?
Yes, unfortunately. I mean, I feel like for the past year, that's like the biggest question and biggest fear of all my patients that I have in my clinic, or they call the office, and, it is safe. I can't stress it enough for patients to come in and see their healthcare provider, whether that's, for their yearly physical or, to see one of their specialists like us at the cardiology office, here in Petoskey. It's safe. We're taking all the precautions necessary, to make sure every patient that walks in the door is safe. So it's so important for patients to, a lot has changed in a year. So, it's so important for them to come in and, get their physical and check their blood pressure and, just blood work, mammograms. It's not good to go a year without having any of those things.
No, and it's, understandably in the beginning, we were all worried and afraid, and there were limitations, but those have been lifted for a long time. And we're going to be in this state of COVID where we are now, as far as vaccinations and still cases, for some time yet. So more than ever, it's so important to go in and get those health checks.
Definitely.
Now, tell us a little bit about the Get Up and Move initiative.
Yeah. So, for the past few years, they've come out with guidelines, and, patients are always asking us, what can we do to get healthy? What's something good, to do exercise wise? And, these studies have come out, and it shows that just 5 to 10 minutes of exercise a day, that's it, 5 to 10 minutes, can reduce your risk of cardiovascular disease. It actually can improve your life expectancy as well, and up to 3 years with just 5 minutes of exercise a day. So yeah, it's great, and it doesn't have to just be, going to the gym like so many people think. It's just 5 minutes of moving.
And any type of movement. And now, while we're all, many of us still stuck at home or solo in our offices, we find ourselves kind of limiting the amount of activity we're having. So with the Get Up and Move initiative, it's really emphasizing, no matter where you're working right now, it's so important to get up and just do that 5 to 10 minutes a day.
Yeah, so McLaren just wants to challenge the community right now. Just move 5 minutes. That's all we need you to do. Just get up and just do it. So.
Well, and if it can help decrease heart disease, that's a huge thing, especially when we're talking Heart Health Month. Now, do you have any tips or examples of simple ways who individuals, maybe that they're not already active, maybe they're not going for walks, maybe they're not enjoying this beautiful, Northern Michigan, winter, summer, or fall is amazing. So we all can do things, but give them some tips how they can participate and get started.
Yeah. So, people that don't have the gyms in their home and things like that, just going for a walk. I moved up here with my hubby like 4 months ago, and all we do is, there's trails and hiking, and there's so much to do outside. But for those people that can't get outside, we talked a lot about, things like dancing in the kitchen when you're cooking, instead of just sitting there, cooking or standing at the stove, dance, turn some music on, have some fun with it. Commercial breaks, if you are that TV watcher or gamer, during that commercial break, it's about 2 to 3 minutes with commercials these days. Do a challenge with somebody that's sitting next to you, do some push-ups or crunches, or if you can't get off the couch, do some, push-ups on the couches, it's just the little things. My brother's a PE teacher, and he actually tells, kids or their adults to do the cha-cha slide when you're brushing your teeth, just 3 minutes of cha-cha slide while you're sitting there, brushing your teeth. You don't have enough time in the day, turn cha-cha slide on, and you get 3 to 4 minutes of brushing your teeth plus a little exercise. So just fun things. It doesn't have to be, the exercise that everyone has in their mind of getting on a treadmill or a bike.
Yeah, there's so many different ways that you can just, like you said, just get up and move. So with the Get Up and Move initiative that McLaren is doing right now, it's on Facebook, right? So tell us a little bit how this works for folks.
Yeah, so most people are social media these days, or on social media of some sort, and you can find McLaren Northern Michigan on Facebook, and they're going to be posting pretty much daily, if not every other day, something about getting up and moving and staying active. And they're actually, challenging the community to go out and move. So they want you to post pictures of yourself working out. And again, it doesn't have to be anything crazy. It could be walking your dog, that you are already walking. Post a picture on one of those links that they post, and they're actually going to do a drawing at the end of the month. So for a gift basket for one winner, and the drawing will be March 1st. But yeah, they just want the community to get up and move, especially when it's so cold up here in Northern Michigan and the snow, just little things. They want to see the community moving.
Absolutely. And that's such a good thing. And as we said at the beginning, now more than ever with COVID and us still working through this pandemic, our health matters very much. So taking all those little precautions and steps. And if you're getting out and moving in public, always wear a mask, as we say. So
Exactly.
But great things. And I appreciate you, Caitlin, taking a few
Yeah.
minutes today and, bringing the cardiovascular program and the Get Up and Move out to the community and the public. And for our business owners, make sure you're encouraging your employees to participate. This would be a great way to get your employees healthy and happy moving forward.
Awesome. Thank you.
Thanks so much. We appreciate it.